Well, good afternoon. I'm honored to be here with Jamaal Magloire, NBA All-Star and Team Ambassador for the Toronto Raptors. Jamaal is an absolute champion and a Canadian legend. Jamaal, thank you for coming down to Queen's Park today. Folks, we're here today to deliver a very important message. We all have a part to play in the fight against COVID-19. One of the best and simplest ways to protect you and your family is to download the COVID Alert app. It's easy to use, totally secure, and free to download. It notifies you if you've been exposed to someone who has tested positive for COVID-19. The app does not store any personal information, unlike most social media apps, including Facebook and Twitter. You just see it and forget it. And we can all be proud of that. The National COVID Alert app was made right here in Ontario with the help of the incredible teams at Shopify, BlackBerry, and the Ontario Digital Services. Since launching this Made in Ontario app, there have been almost 4.5 million downloads across the country, and that number continues to grow. And I have directed that over 26,000 staff in the Ontario Public Service have the app download to their government phones. Because as government employees, we work for you. Those government cell phones, they're your property. This is a very small, but important way that we can lead by example. And I am proud to see the CEOs of major companies and banks have agreed to help promote COVID Alert with their employees and customers. They know this app is a critical tool. They know it's another way to keep their workers and customers safe. And I want to give a few shout outs for the companies here. Maple Leaf Sports and Entertainment, who represents the Toronto Maple Leafs, the Toronto Raptors, Toronto FC, and the Argos. A special shout out to my friend Michael Frisdale. You're doing a great job, Michael. President and CEO of MLSE. Thank you to you and Jamaal for your incredible support. I also want to recognize the Bank of Montreal, Bell Canada, Bruce Power, Canada Life, CIBC Manulife, Enbridge, Postmedia, Royal Bank, Scotiabank, Sun Life, TD Bank, Torstar, and Globe and Mail. I'd also like to thank several outstanding organizations for their support in promoting the app. The Ontario Chamber of Commerce, Restaurants Canada, Residential Construction Council of Ontario, the Canadian Armed Forces, the Ontario Energy Board, Ontario Pension Board, Ontario Pension Trust, Ontario Power Generation, the City of Toronto, and the City of Ottawa. Thank you to these incredible companies and organizations. And for everyone I may have missed, thank you for doing your part. I also want to send a message to all of the other CEOs and business owners out there. Please join the fight. Spread the word to your employees and customers and ask them to download the COVID Alert app. Businesses can go to ontario.ca/COVID Alert to find all the information they need. That's ontario.ca/COVID Alert. And I encourage everyone else to go to the App Store on their smartphones and download COVID Alert today. It's easy and it's free. Together, we can make a difference. Thank you, and God bless the people of Ontario. Now I'll hand it over to Minister Bethlenfalvy.
Thank you, Premier Ford, and good afternoon, everyone. Last week, I spoke to the CEOs of Ontario's largest banks, insurance companies, media companies, broadcasters, and so forth. And I asked organizations like Maple Leaf Sports and Entertainment what they could do to promote the app to their employees and customers. The response was instantaneous. The private sector stepped up and began throwing the resources at the challenge. And I'm proud to join the Premier and Jamaal today, proud of the work we have done in the fight against this pandemic. I'm very proud of the efforts of countless Ontario businesses, organizations, and everyday people who have stepped up to promote the COVID Alert app. And they've done their part to help all of us stay safe. As the Premier just mentioned, almost 4.5 million Canadians have downloaded the COVID Alert Exposure Notification app as of October 13th. That amounts to 16% of the population in provinces where the app is available. And today, I'm very pleased that Nova Scotia has joined Prince Edward Island, Ontario, Quebec, New Brunswick, Newfoundland and Labrador, Manitoba, and Saskatchewan, enabling the COVID Alert app, helping to protect their people and their communities. Over 1,000 one-time keys have been entered by app users in Ontario who have received confirmed positive COVID-19 test results, notifying tens of thousands of Ontarians of a potential exposure so they can take the necessary public health precautions. Now, while we've made great progress, we know we can't stop there. I want you to know we're leading by example. Just before Thanksgiving weekend, we began, as the Premier mentioned, deploying COVID Alert to all compatible government-issued mobile phones. Folks, that's about 26,000 of them to make it easier for Ontario public servants to use the app if they choose to do so. Using the app is completely voluntary for Ontario Public Service employees, and they can still choose whether to activate and begin using it. Because a Premier Ford often says, we all need to pull together in the same direction. And now, as we face a second wave of the COVID-19 pandemic, this has never been more important. Comme le dit souvent le Premier ministre Ford, nous devons tous marcher dans la même direction. Et cela n'a jamais été aussi important que maintenant, alors que nous faisons face à la deuxième vague de la pandémie de COVID-19. We've learned that investing in digital technology and government modernization will be a vital part of both our ongoing response to the pandemic and future challenges. And that's something I look forward to sharing more details on in the coming weeks. Nous avons appris que les investissements dans la technologie numérique et les modernisations du gouvernement seront un élément crucial de notre lutte contre la pandémie et seront essentiels pour relever les défis de demain. Et j'aurai le plaisir de donner plus de détails à ce sujet dans les semaines à venir. Simply put, we can't be an offline government in an online world. Thank you. And now I'd like to invite Jamaal Magloire to the podium. Jamaal.
Thank you to the Premier and his team for having me and all the work that they've been doing to keep us safe during these challenging times. Remind everyone, especially young people, to take proper precautions during this pandemic. Do the following 3 things to keep everybody safe. Wear a mask, social distance, and download the COVID app. I'd like to thank you guys, make sure that you're safe, and hopefully that we can get together under better circumstances one day. Thank you.
Well, thanks, Jamaal. I've never had anyone lean over, but that's good. That's good. I couldn't stop laughing behind me. But anyways, thank you, Jamaal. What an all-star Jamaal is, and MLSE. Thank you so much. And we'll be ready to take questions now.
Okay, we'll go to the phone line for questions. First question, please.
First question comes from Haley Cooper at News Talk 1010. Please go ahead.
Hi, Haley.
Thank you. Hi, Premier. We've heard that the first shipment of rapid tests are reportedly being delivered to Canada this week. So do you know yet how many tests Ontario will get and how they'll be distributed? Will they go to long-term care homes first?
Well, we'll set the priority for long-term care, frontline healthcare workers. I always find it amazing, some of the questions that I get from you folks. I ask the exact same questions. I asked the question this morning, when are they getting here? Tell me how many, so on and so forth. So I should have that answer either later today. I will pass it over to the Minister of Health. Thank you.
Well, we do expect the first shipments very soon, and right now we are about to complete the work that we've done in analyzing the best way to use these tests. Certainly it appears that they would be very helpful for long-term care homes. Also in some parts of Northern Ontario, where the distances in shipping the swabs to the labs may take longer than some people would like. So we're looking at the best possible use of them because we know that they're going to be really helpful for us in adding to the resources that we need in order to fight the second wave of COVID-19.
Follow-up?
Thank you. And my follow-up, Premier, we wanted to circle back with you regarding the third-party delivery app and your plea to them to cut the commission rates charged to restaurants. Have you been given a commitment from them to do that since making the comments earlier this week?
No, not yet, Haley, but another good question. What I've done from the beginning of this pandemic, I always ask nicely, then I start begging, and then I put down the hammer. So I'm asking, don't charge these restaurants upwards to 30%. A lot of people that are ordering the meals don't realize that these poor restaurants that are holding on by their fingernails, these delivery companies, and God bless them, good companies, don't get me wrong, but they're making a fortune. Just imagine, absolute fortune. They're making more money than they've ever made in their lives. And all I'm asking is be part of the team. Don't be greedy, because I can't stand when people are greedy. And don't charge these restaurants 30%. And then on top of it, they got the delivery charge, the service charge, and they keep tacking it on. And the poor restaurant owners are the ones holding the bag. So, you guys pitch in. That's warning number 2, by the way, for the delivery folks.
Next question.
Next question comes from Paula Loricchio at the Canadian Press. Please go ahead.
Hi, how you doing?
Hi, Premier. So the FAO put out a report today that shows that, projects a $37 billion deficit for 2021. And it also says that, the economic recovery of Ontario, for next year at least, really hinges on how hard this second wave will hit.
Yeah.
It also says there's about $9 billion in program spending that hasn't been allocated yet. So is the plan to use that $9 billion to offset some of that deficit, or will you be allocating it to kind of mitigate some of the impacts of the pandemic?
Well, we look at the contingency, that as a contingency. We can't leave the cupboards bare. So there's always things popping up constantly. We do plan on spending that money. But when we're looking at the deficit, and I heard the report, and I just don't believe, and we never believed in this when we first took office, about raising taxes. We can drive efficiencies. We can also look at making it attractive for companies to hire more people, which we did. We gained 307,000 jobs. We saw revenues go up to close to $3 billion. So that's how we're going to get ourselves out of it. We're going to turn this economy on like the likes of which people have never seen by lowering, making sure that we get rid of regulations, get rid of the red tape, making an environment for companies to thrive and prosper and grow and drive efficiencies. It doesn't mean I don't believe in laying people off. What I believe in driving efficiencies, and I'll give you one example before I hand it to the President of the Treasury. There's a few things I always say. I understand economics. Health is not my forte. I let the experts tell me about the health. But economics, when it comes to the President of Treasury, myself, the Finance Minister, we understand it. We came from the private sector. And when we looked at the procurement system, and it really came to light down here when we're looking at getting the PPEs, and we went through the first couple months in a real crisis and finding out how the procurement system, how deep it is. I'll give you one example. We had Alan McDonald come in, support us, donate his time, a former executive at Canadian Tire, and I said, Alan, how many SKUs do you have? How many items, in other words, do you have? And I think it was 50,000. I said, how many purchasing officers do you have? And he said, about 65. We find out in Ontario, because all the ministries, all the agencies, are you ready for this one? We have 7,000 people procuring. That's staggering. We're going to make sure that we have central procurement that, and I always use this example as toilet paper. So we have every agency out there and every ministry, everyone's ordering toilet paper, for example. Doesn't it make sense? And by the way, they go through distributors. So by the time we get it, they put their markup, the distributors, each one of them. Why aren't we going to Irving Tissue directly? They're down the street. Why aren't we going directly to Kimberly-Clark up in Huntsville? Why don't we order in bulk like any other normal company, no matter what size they are, and everyone goes online and bang, okay, we need 1 case of toilet paper. But guess what? When you do that, you buy in volume and you get a lower cost and you're saving taxpayers money. We're guesstimating we can save upwards $2 to $3 billion by centralizing procurement, no matter if it's toilet paper, pens, paper, whatever it is. But having 7,000 purchasing agents, that's ridiculous. And everyone has their favorite little guy or gal and going through distributors. Well, folks, all these companies, the party's over. We're going to start driving efficiencies, putting more money into the taxpayer's pocket until they can go out and they can go spend it and get the economy going. Simple economics, but I'm going to pass it over to the President.
Well, thank you, Premier. Before I answer that question, I do want to say that the Premier and the Deputy Premier are here every day talking to Ontarians, talking to the media, because they want to keep Ontario safe. They want to keep Ontario healthy. And the better we do there, of course, the better our economy will do. So they go hand in hand. My job is to make sure that they have the firepower. And let me tell you, the firepower is there. So when you ask, we still have some money left. We have 5.5 months left in our fiscal year. We're going to use that money because we are going to spare no expense. We are going to spare no expense to make sure the people of Ontario, the families of Ontario, the businesses of Ontario are kept safe, because that's our #1 priority.
Follow-up?
So the report also says that if the province, if your government still wanted to balance the budget by 2023-24, as was, you know, the previous recovery plan from the 2019 budget, that it would take about $14 billion in permanent revenue increases or spending cuts or some combination of those two things. First of all, is that still the plan?
No.
To balance by 2023-2024?
No.
And if so, are you looking more at revenue increases, spending cuts, a combination of both? What's the plan?
Well, another good question, but no, that was the plan prior to the pandemic. Now we're in a whole different ballpark, and we're gonna do it over a number of years and be thoughtful about it, responsible, and make sure, as Peter was saying, that we're going to make sure the #1 priority is to get companies back on their feet, get families back on their feet, securing more jobs as we did prior to that. I know we had the numbers, job numbers go up, but this is like a roller coaster. We're still about 340,000 roughly behind before we were with a pandemic, but we're going to go back at it, and I'll pass it back to the President of the Treasury.
Yes, thank you again for that question. So we're not going to be balancing the pre-COVID numbers. I think that's just the reality. And again, along with the Minister of Finance and myself and the whole team, we're going to make sure that we take first and foremost the safety and health of all Ontarians into account. Now, we have to file a budget by November 15th, so we're hard at work at that, and we'll obviously have more to say. But there should be no question in the people's minds in Ontario that the Premier and the Deputy Premier and the whole team and all of caucus are working 24/7 and have been since COVID broke out to make sure that we provide the supports fiscally to make people safe, families safe, as I said, and the businesses, because they all go hand in hand. There will be a time to look at the books in more detail, but now is not that time. And we'll make sure that we spend the money in the most efficient way. And as the Premier said, there are other ways to spend money smartly. The COVID Alert app was a great example of something that was basically developed by the Ontario Digital Service, so that's in my ministry now, along with Shopify and BlackBerry, who provided resources for free. And we handed that over to the federal government. And by the way, we got some of the code from Alberta. So a real partnership, provincially, federally, provincially, in a smart way, with not a lot of taxpayer expense, to make sure people are safe. And we're going to continue to do that.
Next question.
The next question comes from Lorenda Redikoff at CBC News. Please go ahead.
Hi, Laura.
Hi there, Premier.
How you doing? Good.
This first question is on the modified Stage 2 closures. We've been finding frustration and also confusion. In one case, a martial arts studio is remaining open. It says it's not a gym, but that it's a private sports club, and so can stay open. Then Gymnastics Ontario says under the rules, its competitive teams can still train. And then there are dance studios who say they're being unfairly lumped in together with gyms and so aren't allowed to open, while things like kids hockey can continue. So what's your response to these organizations? And also maybe there's some clarification on what is allowed.
Before I pass it over to the Minister of Health, you know, some of these areas, be it karate one-on-one or dance, I'm a big supporter of these dance companies and training facilities that they have some really young athletes. They're following protocol. They're wearing masks. They're practicing social distancing. They're doing everything. So I can't disagree. There's a lot of things I can tell you. I don't always agree, but I have to listen to the health and the science, epidemiologists, and the rest of the team. You don't think it frustrates me, but I can tell all the dance studios, I'm onto it. I will ask. I will drill down for you, because I think it's important. I'm a big fan of these organizations, and I'll do everything I can. But at the end of the day, I still have to listen to the docs. But there has to be a balance here. You know, it's critical. I can't emphasize this enough to our health team. I can't emphasize it enough to our 34 chief medical officers. When these decisions come down, you're all incredible medical minds. We have some of the best in the country. But you got to weigh the economy. You got to weigh people's livelihoods. You got to weigh mental health, because a lot of people are on edge right now, and I feel it out there. I talk to people. I'm talking on the phone all day, all night, talking to people out there. So we got to have that balance. So to all the folks in the dance studios, I'm going to address it, and we'll be able to get back to you on that. And I'll pass it over to the Minister of Health.
Well, having to move Peel, Ottawa, and Toronto into a modified stage 2 level was a very, very difficult decision, because, as the Premier indicated, we know how difficult this is for many business owners, for many families to have to deal with this. But we do have to listen to what the Chief Medical Officer of Health, the Health Measures Table, all of the advisors, and it's not just a few people. There are many people involved in giving us this advice. We have to make decisions based on scientific and clinical evidence, which we did do. Now, from time to time, there may be some areas where there is further clarification that's necessary. The Premier indicated that he's looking into the dance studio issue, but for anyone else that has any concerns about whether their enterprise is caught up in these restrictions, they are always available to speak to their medical officer of health in their area, or to certainly direct it to the Ministry of Health, and we're happy to give them further information and help in that respect.
Follow-up?
Thanks so much for that. And this one is from my colleagues in Ottawa. What do you see that's happening in that city that we have such a higher rate of infection than here in Toronto? And do you believe that the number of people getting tested could be playing a role there?
Yeah, I'll pass it back to the Minister of Health. But again, as I mentioned yesterday, 70 to 100,000 people, and that's higher than Toronto. I think Toronto was 57. So that's concerning when you're the highest in the entire province. So I'll pass it over to the Minister of Health.
There are a number of different issues that relate to the increase in the Ottawa area. For some of them, it's related to bars, restaurants, and so on. For others, it may be gyms. For others, it may just be sociable activities, children's birthday parties, and so on, which are asking people, please do not have anything larger than 10 people inside, 25 people outside, but really, if you can, just get together with your own household, because we are very concerned about the transmission in the Ottawa area. We're seeing it move into some of our long-term care homes. We're also seeing it increasing hospitalizations as well, and that has a direct effect on people's lives and in ways that people might not realize. So, for example, we're saying to young people, particularly, please don't go out and get into large groups, don't get together for parties and so on, because that might mean somebody will catch COVID and they'll end up in hospital. But what that also means is, if, for example, if you're a young person and your mother has to go into hospital because she has breast cancer and she has to have a cancer surgery, that might mean that that hospital might be too crowded and your mother's surgery might get canceled. So this has a real impact on everyone's lives. So it's for that reason we really ask everybody to please continue to follow the public health measures.
Next question.
The next question comes from Melissa Candelaria at Your TV Halton. Please go ahead.
Hi, Melissa.
Hi, Premier. How are you?
I'm doing okay.
I guess my question is regarding just back to the stage 2 process. There's been a lot of regional crossover, people who have been coming to our region in Halton from the hotspot areas like Peel to go to our local gyms or restaurants and what have you. So I guess my question is really how effective is closing, or
diverting certain areas, hotspots, back to stage 2 when these people from these areas are coming into smaller regions and those that don't have a high report of COVID-19 cases.
Yeah, I've heard the same thing, and large fitness places as well, that they're traveling from the hotspots into other regions to go work out. Folks, I just got to ask you, try to work out at home. The big fitness clubs are saying they don't want you to come there, and I understand. So if you can, try to work out at home, and I'll pass it to the Minister of Health. And talking about working out, we got to, guys, throw me a question for Jamaal. He's itching back there. I can tell he has a bright future, not only bringing us another championship, I think he has a bright future in politics.
Well, we certainly do recognize that when you make a movement with one particular area, such as we did with Toronto, Peel, and Ottawa, moving them into modified stage 2, that there may be people that will move from their areas to other lower risk areas, and that can cause community transmission there as well. So we're watching every part of the province on a daily basis to understand how many new cases are arising in each particular area. We'll take action if we need to, but as the Premier indicated, please stay within your own region. Please work out at home. Please obey the rules and regulations affecting your home region so that we don't end up with problems in other regions in Ontario. What we really want to do is bend this curve, get these numbers back down again, and if we have people traveling around outside of their own home area to get some of these services, that's going to only add to our numbers and add to the problem. So please stay where you are, work out at home if you're able to, and stay within your own region.
Follow-up?
Yes, but further to that, though, if in fact, people continue to not listen and do this, is there potential that the government will have to put more regions into a similar stage to offset those that continue to break the rules?
Yeah, if the spread continues and it goes into other regions, yes, the answer is yes. But again, we can't police 14.5 million people. Everyone's pitched in, everyone's helped out, everyone's followed, for the most part, the guidelines and protocols. So that's all we're asking. Please, just follow the guidelines, and everyone should be better off at the end of the day.
Last question.
The last question comes from Tina Yazdani at City News. Please go ahead.
Hi, Tina.
Hi there. I actually wanted to ask about York Region, which is seeing some pretty high numbers the past few days, even surpassing Ottawa. And I was wondering why that region hasn't been moved to a modified stage 2 yet.
Well, we'll be sitting down again with a health table, and we have a meeting, the Minister and I, after this. But yeah, York's teetering right now. Sorry, and they've been teetering for a little while. And so we just got to be careful. So we're keeping an eye, a very close eye on York right now. It's concerning.
Follow-up?
And this probably is for the Health Minister. I'm wondering why our testing numbers are down again this week. We were hovering between 40 and 50,000 just last week, and now we're back down to 30 to 40,000. And what is the next step to try and hit that 50,000 a day target?
Well, I'm sure we will get those numbers up again, but I would suggest that because last weekend was a long weekend and people had other plans because it was Thanksgiving weekend, that was a reason why the numbers dipped. But I'm sure that the numbers will be back up close to 50,000 again within the very next few days. Thank you.
Thank you, everyone.
Thank you.